been a controversial topic for so many years, but our understanding of Candida overgrowth has really significantly evolved. So today we're not asking whether Candida exists. We know that it really exists. The question is, with Candida overgrowth, what does that tell us about inflammation, metabolism, and overall health? Now, researchers are exploring connections between Candida overgrowth and conditions like obesity, insulin resistance, we like talking about that here, metabolism, even fatty liver here, right? So today we're going to discuss what the science says, who may be at risk, and then how we evaluate how to pick up Candida overgrowth, and then most importantly, what do we do about it? So welcome to the Natural Doctors. I'm Dr. Jen Stagg, along with Dr. Katie Dinello, and we're going to, start off by saying what is really this big shift that's happened and how we're thinking about Candida today.
Yeah, definitely, right? We're kind of looking at Candida in a new way because, like you said, we know it exists. This is not new, right? So when we are seeing this on a stool test, we're kind of like, okay, yeah, like checks, we get it. But really, we're looking at it in terms of kind of the whole architecture and foundation of the gut and how it relates to the whole picture of our microbiome, of our dysbiosis, and then in the greater context of what else is this patient presenting with? Do they have sugar cravings? Mm-hmm. Do they have insulin resistance? Is there cardiovascular disease, right? What are their gut symptoms? So we're not looking at it as this isolated organism, but instead, how does it fit the whole picture?
Right. Yeah. So now we know more about the, qualifying the microbiome, which everyone understands is like bacteria in the gut. Now we have well described the mycobiome. So those are all those yeast in the gut as well. And they form this, mixed microbial community. And just like bacteria can get out of balance and overgrow and undergrow, then yeast, more the concern is overgrowing here, obviously, not undergrowth. And so understanding that, we then sort of think about these patients as like, what's happening with the terrain here, right? Not just like, oh, we're just picking up some yeast. We still have to address yeast overgrowth, but it's still a bigger picture of how are we going to really balance out this patient's like microbial community in their gut versus just like, oh, we have to eradicate all the yeast.
Right.
And that's all there is to it.
It's
right?
So true. And I think two important pieces there. Number one, people should realize we're not talking about like a systemic candidiasis infection because that is very significant and severe, and we're not talking about that.
And that's like hospital situation, immunocompromised.
Exactly.
I'm glad you pointed that
out. Just
out.
so people know that. The second thing is, like we know that a lot of people have Candida. I'll use myself as an example here. I have Candida in my gut, and I have tested myself enough times where when I am very symptomatic in my gut, bowel movements are off, lots of bloating, right? My Candida levels are a lot higher. So that's another piece of the puzzle is what are those levels, right? Are they a little bit lower? Are they higher? And then again, what are the other bacteria levels in your gut looking like? For me, I know a lot of times I also have low Akkermansia, low lactobacillus when I also have higher levels of Candida. So it gets interesting.
Right, yeah. So it's not, as I said, it's not as easy as just let's wipe out all this like entire fungal community. Another thing we're not talking about here are really, rare and severe forms of types of yeast that are, infections that are very serious and need to be treated in a hospital as well. So here we're talking primarily about Candida species, so Candida albicans, Candida tropicalis. Those are the two that we're going to see on these microbiome reports that can live in the gut. The albicans is the one that, takes up a bit more, space there. And not only the gut, we know this can live in all the, all the mucosal areas, right? In the mouth, people have heard about things like thrush, vaginal Candida overgrowth, right? These are all things that maybe you've never heard anything about, like, what are you talking about Candida in your gut? Then this might be new to you. You might, obviously, if you're a woman, have heard about having a vaginal yeast infection, right?
Yeah, exactly. Yeah. And like you said, the oral thrush, that's another common one where it's actually interesting, like, sometimes I'll get a patient and I'll be asking about their gut health, and their gut health will be, not too bad. Okay. But then, even in subsequent visits, they'll be like, oh yeah, there was that one time I had oral thrush. And then, oh yeah, like back in my, 20s or 30s, I had recurrent vaginal yeast infections. And I'm like, oh, whoa, okay, hold on.
Right.
Here.
Then you're like ding, ding, ding.
Yes.
Okay. So that sort of leads us into, what are the types of patients that we think about here? And I think, where you were leading with that was along the lines of patients now that are coming in with like sugar cravings, metabolic conditions, insulin resistance. We love to talk about insulin resistance here, but like now, like that's a big part of the conversation, right?
Yeah, exactly. And this is why our medicine is so nuanced and complex and layered. It's because a patient may come to us wanting to lose weight. That might be their chief complaint. And then we end up talking so much about the gut because they're like, yeah, I have these intense sugar cravings. My hemoglobin A1C has been increasing. My blood sugar has been increasing. And then, oh yeah, like I'm a little bloated sometimes. And I'm like, whoa, actually, those are really connected. So Candida, when we have any type of dysbiosis, whether it's bacterial or fungal, we tend to have more sugar cravings because, sugar is an important player for what the Candida craves, And so we sometimes, this is cliche, but it's like, okay, you are what your bacteria want, or you're craving what your bacteria are eating, right?
Yes. Yep.
And so with Candida, a lot of times we see that overgrowth if patients are like, yeah, I just cannot stop eating sugar. I'm really addicted to it. Or even like if patients are having a lot of tortilla chips, a lot of bread products, right? Even things like that. It might not just be candy or chocolate.
Yeah,
but,
right. Yeah. And it does. You're right. Like that does control. We have that gut-brain connection, and there are metabolites that come out of yeast and bacteria, but especially with the yeast, there are all these Candida metabolites that communicate to your brain just like a neurotransmitter would and send you like seeking sugar and carbs to help keep that going, right?
So it's not uncommon for us to see these associations with patients who struggle with obesity, insulin resistance, fatty liver, metabolic syndrome, high triglyceride levels, right? These are definitely associated with that Candida overgrowth.
And there is like a pretty large body of evidence really looking at especially type 2 diabetes and obesity. And when we check these patients, like I don't think I've ever had a type 2 diabetic who we've done microbiome testing that the Candida does not show up. And it's off the charts high in the type 2 diabetics, like so high that I'm like, oh my gosh, this is so high.
I see it too. So, okay, that leads into a really good question of like, well, what kind of came first? Is it the metabolic syndrome? Is it the Candida? What do we treat first? And the way I explain it to patients is, it's really hard to tell, and we will probably never fully answer that question, but they kind of are feeding off of each other, right?
Yeah.
So by the time somebody is symptomatic and they have, let's say metabolic syndrome and these gut symptoms, this Candida overgrowth, the way I say it is it doesn't really matter which one came first, but we need to put a pin in that cycle so that we can stop them from feeding off of each other.
Yes, 100%, right? It's that vicious cycle. And yes, everybody always wants to know why, like what's going on there. But yeah, we just honestly, we don't fully know that answer yet. So I'm glad you brought that up.
Yep, it's tricky.
All right, so let's talk about these patient populations, right? So we'll get back into metabolic disease, but who should be paying attention to Candida overgrowth? So we sort of started mentioning some of these sort of like skin mucosal conditions. So thrush. Vaginal yeast infections. But another big one that I see and often coming along with patients who are type 2 diabetic or pre-diabetic insulin resistant is rashes under their breasts, like under, like in the bra line that, they're using. And a lot of times they're using antifungal creams and it's just like not clearing. And then they're told like, oh, get some like powder in there. Like they're doing all sorts of things because they're saying like, oh, I'm sweating in there, and it's an environment for it. But it is, even though it's on the outside, and this is something that often, you know, when we're dealing with acne and skin conditions, when things are on the outside, there's stuff going on inside too, right? Especially when it comes to Candida.
Yeah, it's
so
so true.
That under breast, armpit,
armpits, anywhere there's friction with the skin, right? We can see that for sure. And it is pretty common. We definitely see it.
Yeah, so that's a big one.
Yep. And then, of course, you know, when you have gut symptoms too, right? So if you have a lot of bloating, if you have constipation, sometimes if you're going back and forth between loose stools and constipation, but I would say that bloating is definitely a key factor.
Yeah. And we bring up this a lot on the show about bacterial overgrowth. So SIBO, small intestinal bacterial overgrowth, and then SIFO, small intestinal fungal overgrowth.
Yep.
And that basically presents with those similar symptoms of bloating, you know, digestive, you know, distress, I don't know, like discomfort. And, you know, a classic patient is someone who has been treated for SIBO and it's not clearing. Now, sometimes it doesn't clear.
Right.
But if they have never been evaluated for Candida overgrowth, then that could be what's actually continuing to cause the symptoms.
Definitely.
And there's some really good studies on this showing pretty high rates in these patients who have irritable bowel and SIBO that doesn't clear.
Yep. The other thing is patients who have been treated for SIBO with antibiotics.
Yes.
Or just any other gut infection or any type of infection where they've been on antibiotics, right? Because those antibiotics are clearing a lot of the bacteria out, which just gives more space for that Candida to grow. And so then, you know, that patient may have had just a little bit of yeast or, you know, Candida in their gut. They took the antibiotic and then the Candida kind of overgrew. And so then you've used the antibiotics to now create another problem. Right. So, you know, that can be frustrating for patients.
Yes, and that shows up with women a lot too. So, and that's something that's really well recognized in the medical community with women, and they go on an antibiotic and then they get a yeast infection. A lot of them have like a script for diflucan on hand for whenever they go on an antibiotic. But the connection with, oh, you could get fungal overgrowth in the gut going on an antibiotic is not there, right? Like that's not something anyone really considers as problematic.
Yeah, unfortunately.
Yeah, so that's a big one. And then I guess, and also like hormones is a sensitive time, right? Women who like childbearing age, this can be an issue.
Yes. And I think too, that comes into play, you know, if we're having hormonal dysregulation, we're having really heavy periods, right? We have to remember that just like we have a gut microbiome, we have a vaginal microbiome, and that can be thrown off just as easily as our gut can too. So, you know, we see this a couple of different ways, right? So if you're having hormonal dysregulation, which is causing estrogen dominance, heavy periods, things like that, that could potentially lead to that yeast infection, that Candida overgrowth. But similarly, if you are using, you know, there are so many over-the-counter products for like fragrance, right? Soaps, moisturizers, lubrications, right? And so that also can really disrupt the pH of your vaginal microbiome. And then that can also cause a yeast infection. So I'm always telling my female patients, no. Don't use it. If you need lubrication or if you have vaginal dryness, come to me first. Let me tell you what to use. And don't use soap. There's just, we don't need it. If you know, you have an odor coming from that area, right? Then we've got to work on the microbiome. What's causing it. Exactly.
So important.
Yeah.
All right. So maybe we get into that next population, probably the biggest population, and we're a ton of the sciences right now around patients that are insulin resistant, obesity, liver disease, or fatty liver disease. These patients are really at risk of, you know, fungal overgrowth in all the ways we just listed, but especially in the gut.
Yes,
right?
Definitely.
So go ahead.
Yeah. So we're seeing, right, that metabolic dysfunction where we, over time start to have a more sedentary life, maybe a calorie excess, we're intaking more sugar. And this is not to shame anybody, right? Like this happens, right?
Yep.
Life gets busy and crazy. And so what happens is we start to develop that insulin resistance, which we've talked about a lot, but our pancreas is starting to release more and more insulin because those cells are not quite sensitive to it, right? Insulin levels go up, glucose levels go up, and that connection between elevated glucose levels and Candida is pretty strong because we also know that Candida likes sugar.
Right.
And so we see that connection of people who have diets that are higher and more refined carbohydrates. They're going to be the ones to then go on and develop insulin resistance, which over time can lead to fatty liver, right? And then again, we see that association with Candida.
Yeah.
So it is all really connected.
Right.
And it is a little bit tricky to explain that to patients of like that connection between that metabolic health and our gut. But fixing one or the other can really significantly positively impact how you're feeling in that other area.
Right, especially, for patients. I've seen patients, again, with type 2 diabetes, pre-diabetic, that are showing up to have high levels of Candida, and we're doing the lifestyle work. And then we start up with, okay, we need to get these Candida counts down, really sort of get the bowel bacteria normalized again. And they will find that will help with keeping them on track, right?
Yes.
Their sugar cravings actually do come down.
Exactly.
So you're right. Like, it's like you've got to be working on both sides, right?
Yep,
Yeah.
definitely.
So important.
Yep.
The third population, or did you have anything else you wanted to say
No,
about
I was going to
that
say,
population?
let's start talking about that inflammatory bowel
Yes.
disease, that chronic gut inflammation, right?
Yeah.
So inflammatory bowel disease, for people who don't know, are things like Crohn's disease, ulcerative colitis, so really serious conditions that we want to take seriously. But we do know that there is a connection between Candida overgrowth with diagnoses of IBD.
Yep.
Yeah.
Yeah. So you'll see high levels. Again, like I test these patients, and I don't think of the patients I've tested. I mean, this is my own sample, but everyone I test will have elevated levels of Candida.
Right.
And again, some of these patients are the highest levels, right?
It's
like
so true.
so high.
And we want to be clear, we're not saying that Candida overgrowth causes IBD. That's a very complex picture as to what causes. It's very multifactorial, but it is one piece of the puzzle.
Right.
And so especially when these patients are really symptomatic, that is one of the first things I'm thinking about is like, what does our microbiome look like? Is there Candida overgrowth? Is there bacterial overgrowth?
Yeah. And then the other thing I would add on is when we address the microbiome and address those Candida levels and retest, and the levels are improved, it typically almost all the time correlates with an improvement in their IBD symptoms, right?
Yep.
So that's a nice thing for them, obviously, that they're getting better control. And even when we're looking at inflammatory markers like calprotectin, for these IBD patients, that those counts can come down, and I'll see that lining up with the Candida. So that's
great.
That's awesome.
Yeah.
So something, little tip for anyone out there who has inflammatory bowel disease, to maybe look at Candida.
Yep.
All right, so we should get
test?
into what are we even doing? How are we helping these patients?
Yeah.
Oh, well, sorry, like how do we test first, and then because we have to pack all this in. Okay, so how do we evaluate for Candida?
Yeah, so we do it through stool testing. I'll be honest, maybe we differ a little bit here. We'll see. A lot of functional medicine and naturopathic doctors will do a blood test to look for an antibody to Candida.
Yeah.
There is one test that we use that has it on there, but that is not my gold standard for testing for Candida, right? Because a blood antibody to Candida just tells us that we've had Candida at some
and you're
point.
seeing it.
Right.
So it doesn't mean that it's like active or anything.
So I like to actually do a stool test where we can test for it.
Yes.
We use a great company, a great stool test that's very, very accurate. And you know, I have seen some really, really high levels in people, and it's pretty wild sometimes.
Yeah, it
I'm
is. Yeah. And it's a simple test. The test that we use is from Biome, BIOHM. It's founded by Dr. Ganoum, and he's the world's leading expert on Candida.
Yeah.
So pretty reliable testing, I imagine.
Yeah, it's a good test, and people can order this, right?
Yes,
like you
exactly.
don't need a doctor.
Yeah, so you actually can get that direct to consumer, and it's a really simple swab.
Yep. Yep.
Okay, so let's get into, you know, we've sort of been mentioning the approach has changed. We're really looking at, you know, a switch from just eradicate, find the Candida, kill it, get rid of everything, to, okay, looking at, we have an overgrowth situation. Why did that happen? But, you know, we certainly want to sort of like start with getting the overgrowth, the counts down, but we're looking at really improving the whole, what we call terrain, right?
Exactly. Yeah. So we're not using these harsh, you know, prescription antifungals, right? We are using herbal antimicrobials that have, you know, some really nice antifungals in there, maybe some antibacterials in there to really work on that whole community. And we are taking into consideration, like, if we're doing a stool test, what else is low versus high on that stool test so we can really pick the right combination of herbs. You and I both really love oregano oil, actually,
so
for
good
Candida. I love it. I really love this herb. It's powerful. It, you know, it tastes pretty tough when you're taking it in capsule form. But I tell my patients, like, hey, it's medicine, you know?
Right.
It's all good.
Like,
Just
there's way
pretend you're
worse
eating pizza.
medicine than that one.
Yeah.
Garlic
Exactly.
can be helpful.
Garlic can be helpful too.
There's some really nice blends that have a lot of herbs that people haven't heard of before that are so potent. So, I mean, if you're dealing with this, working with a naturopathic doctor or functional doctor that really does a lot of this work can really turn things around. And then the other thing we add on when we're sort of like working on these overgrowth situations in the beginning is what's called biofilm disruptors, right? So Candida will grow with bacteria in what's called a mixed biofilm. So it's basically a matrix, and we need to break that down in order for the antifungals, the antimicrobials to work. And some of the best ones that we both love, Saccharomyces boulardii, right? Which is actually a yeast. Seems weird, but it is a great biofilm buster. And then enzymes as well here.
Definitely. Yeah. I use both of those products. And I will say, if somebody has pretty high levels of Candida, I'm pretty immediately putting them on a biofilm disruptor, and I'm kind of just assuming it's going to be a little bit harder to treat because that Candida has probably been building up for some time and has had time to establish those biofilms. So pretty much right off the bat, I'm like, okay, let's put you on some biofilm disruptors too. And then we need to remember too, there are follow-up steps after that, right? So replenishing with good pre and probiotics. We don't just put people on these, you know, herbal products to kill off the Candida.
Forever.
No. And you definitely don't want to do it.
And this is where people in the past would get into, I think, not being able to get out of the Candida cycle, because I would have patients in the past that would be on herbal antifungals for years, and they every time they tried to go off of it because that was the only thing that they were doing, their Candida would come back, right?
Exactly.
So this is where we want to be working, just like you said, on supporting a really healthy, like, entire gut microbial community. Prebiotics. So food matters.
And
here,
then food.
right?
So let's talk about it. Now, I have done a lot of different things for food for patients when it comes to treating Candida. There is something called that anti-Candida diet. It's very challenging for people to follow. It's brutal. I have had a handful of patients who, with tough cases, have been like, sign me up. I will do whatever. I am so bloated. And they do a really great job, but it's
you have to be really motivated.
You do, yeah. And it's very low glycemic foods, right? So if any,
and no vinegar.
Yep. Really low amounts of fruit, even berries, virtually no processed carbohydrates. So your breads and your rolls and your tortilla chips, right? All of that is a pretty hard no. So diet can be really tricky, but if we not every patient needs to be that extreme, but we do really need to focus on glycemic index of foods.
Yes.
And
cutting, like legit cutting back on the sugar.
Definitely.
Right?
Oh, definitely. Yeah, you have to. Because, you know, yes, treating your gut is going to help with those cravings, but also you've got to put a pin in it on your end too, because herbs alone aren't necessarily going to 100% cure those sugar cravings, right? You at some point have to be like, okay, like I've got to stop consuming this, because that is going to significantly help with those cravings when you're using it in conjunction with herbs.
Okay, great. So we don't have much time left, but maybe we just do a little myth busting.
Yeah, let's do it.
Okay, here's one. Candida is to blame for every symptom.
No, right? And that's not true of anything.
pretty obvious.
I do think that some naturopathic doctors do get into this pigeonhole of, oh, that's your gut, that's your gut. And when you and I complain about this too, when we're reading a lot of newer research articles on the gut, there's a gut access for every organ now. And it's just like, okay, people, let's like chill out here a little bit, right?
It's like, it is all related.
Yeah.
And I guess the other one we could bring up, which I think we answered, if I have Candida overgrowth, I can never eat fruit again.
Yeah, no, that's not true, right?
Yeah.
Like the goal is that we treat you, and then of course you're going to be able to eat fruit again. We would never tell patients to not eat fruit forever.
Right.
So yeah.
Oh, all right. So what a great episode. Tons of information here. We could go on and on like usual, but we just don't have the time. So thank you for joining us on another great episode of The Natural Doctors. Don't forget to subscribe so you never miss an episode.
Hi, I'm Jay McCormick, a board director at Nutmeg TV, your local public TV station right here in Farmington. Nutmeg TV has been an integral part of our community for over 30 years, providing a platform for residents to share stories, voice concerns, and celebrate achievements. It's a vital resource that connects us all, bringing countless local events to our TV screens. The topics are limitless and vary from being aware of scams to veterans helping veterans. Nutmeg TV continues to be here for the community. To continue this important work, we're asking for your support through a donation. Your contribution will ensure that Nutmeg TV remains a robust and relevant resource for our community. Thank you for supporting Nutmeg TV. Together, we can continue to amplify the voices and stories that make our community unique and vibrant.
To make a donation, simply visit our website at nutmegtv.com or call the office at 860-321-7405 for assistance.